Special thanks to the people who have made the production of the American Health Journal possible.
Toshiba Medical Systems, providing physicians with imaging tools to improve diagnosis since 1914.
This program has been presented in part by Ledesma and Meyer Construction. Building for a common vision.
And special support from Southern California Physician Magazine, the official publication of the following medical associations. Southern California Physician Magazine, the magazine physicians read.
And generous assistance from HF Healthcare, serving the hemophiliac community.
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello, and welcome to the special edition of the American Health Journal. I'm your host, Roger Cooper. According to the American Academy of Ophthalmology, more than 175 million Americans are in need of vision correction, or they're affected by cataracts or dry eyes. Today, we'll visit with doctors of NVision Eye Centers, clinical investigators for some of today's newest eye and vision technologies, to learn about the latest advancements for these common eye conditions. We begin our program by revisiting a common condition that can have a tremendous impact on daily life: moderate to severe dry eyes. We talk with Dr. Thomas S. Tooma, Medical Director of NVision Eye Centers, about the prevalence and the causes of dry eyes.
About 11 to 17% of the adult U.S. population does have moderate to severe dry eyes. That's more than 20 million people. There are many things that cause dry eyes. Sometimes it's associated with systemic illnesses like autoimmune disease, rheumatoid arthritis, lupus. Sometimes it's associated with medications like water pills, whether people are dieting or for high blood pressure. Other things are like environmental causes. So if you're sitting in front of your computer for a long time, or you're out in windy, dusty environments. Allergy medications, antidepressants, diabetes, and hormonal changes past menopause are associated with a significantly higher incidence of dry eyes. But the majority of dry eyes are associated with a condition called meibomian gland dysfunction. And with that condition, basically you're not producing the oils that are necessary to prevent the tear film from evaporating. And so you're making tears, but they're just evaporating too fast. And that's about 7 out of 10 people who do have dry eyes have a condition called meibomian gland dysfunction or blepharitis. Most people with dry eyes have a foreign body sensation. They just feel like there's something there all the time. Frequently, they complain of fatigue. Their eyes just feel tired at the end of the day. Burning sensation, a gritty feeling in the eye. All of those are common symptoms of people with dry eyes.
Dry eye doesn't always hurt. Sometimes your eyes can just be really red. They can look irritated. But oftentimes people do complain of a burning or a stinging sensation. So a lot of people don't realize they have dry eye. They're walking around with it.
They're always so dry. There's always a discomfort. There's always an irritation. And then it affects my life, the activities I do, my career. I always have to put eye drops in. I always have to make sure I'm wearing glasses or some sort of protection to protect my eyes.
We now have the ability to actually assign a number to the severity of dry eyes, much like we'd assign a number to a patient's cholesterol level. And it's done by taking a small sample of a patient's tears and analyzing that tear analyzing the osmolarity of that tear. The higher the osmolarity, the more severe the dry eye, and the higher the number. Osmolarity basically is an aspect of maintaining equilibrium in bodily fluids. And when that equilibrium is no longer able to be maintained or disrupted, which is called hyperosmolarity, that indicates basically disorder and could lead to disease. So tear hyperosmolarity is believed to be the central, or I guess the main reason why there's ocular surface damage and inflammation, thus leading to dry eye.
We ask about the non-invasive treatments and the home remedies for dry eyes.
Home remedies for dry eye can be effective depending on the severity of the dry eye. So home remedies may include warm compresses and lid scrubs, where you're asked to take a warm washcloth to the eye for about a minute or two to use heat to liquefy the secretions that come out of the oil glands of the eye. And those oils are important to keep any tears produced in the eye as opposed to evaporating off. Lid scrubs are often indicated when patients have bacteria buildup at the base of their lashes, and that bacteria can often cause inflammation at the base of the lashes, causing the eyelash lid margin to be reddened and to give patients symptoms of like a grain of sand in their eye.
One of the biggest factors that we find that people could be benefit from is just drinking water. They're dehydrated. Most people are dehydrated, and drinking enough water will help rehydrate the eyes.
Tranquilize is actually an eye hydrating system that was created for patients that needed more than 1 to 2 minutes of heat therapy to liquefy those oil secretions that we were talking about earlier. So it's an actual goggle that uses a reusable gel pack that creates heat that lasts a good 20 to 25 minutes. The gel packs are inserted into a goggle, and the goggle is placed around the eyes to provide a nice seal to provide the heat needed.
Again, most of these home remedies are good for mild cases of dry eyes. When we get to moderate and severe dry eyes, we find that these things are insufficient to solve the problem.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this PBS station.
Welcome back to this special Eye Health and Vision edition of the American Health Journal. We've been learning about some of the causes for dry eyes, as well as home remedies. But when these aren't enough, there's still hope. While we're talking with NVision founder Dr. Thomas S. Tooma, we ask about the advanced and surgical treatments for dry eyes.
The most common treatment, and that's what most people who have dry eyes use, is artificial tears. But most patients then find out that they're having to use them more and more and more, and the effect doesn't last as long. And so that's when we go into more advanced treatments. So beyond using artificial tears, there are some specialized medications that people use. One of them, where you hear advertised on television frequently, is Restasis. That's effective in increasing the amount of tears that are being produced. So that's a special segment of dry eyes that's called tear deficiency, where they're not making enough tears. But if you're making enough tears and they're evaporating too fast, that's called evaporative dry eyes. And that's where the oil layer that covers the tear film is not being produced. And that's because the glands that are supposed to make those oils are plugged up. And so what we do, the advanced treatments for dry eyes that are relatively new, are aimed to unplugging these glands and making them start working again. Intense pulse light is frequently used for skin rejuvenation, where we're using this very bright light at a special frequency and a special repetition rate to rejuvenate the skin and make it just glow and look better. But an ophthalmologist recently found out that when he was using that treatment on some of his patients, they came back and said that their dry eyes were getting much better. And what he found out was that the intense pulse light is actually working on the glands that produce the oil secretions that are preventing the tear film from evaporating and improving these secretions and making these glands work better. So that's why we use the intense pulse light, is for people who have meibomian gland dysfunction that is causing evaporative dry eyes. We've discovered that by using that, we're also able to heat up these oils that have become solid and plug up the glands, and we're able to express those oils with the heat of the laser, and by expressing the glands and getting these secretions out, we're finding out that that is substantially improving the symptoms of these patients because their tears are not evaporating fast anymore. A good candidate is someone who does have meibomian gland dysfunction, blepharitis, causing the evaporative dry eyes. So the patient needs to seek a consultation, obviously, with someone who's specialized in dry eye treatment and does have that treatment available. Typically, the IPL treatment is performed over 4 sessions, and the sessions are separated by about a month apart. And then we need a tune-up session, which is 1 session about every 9 months to a year after the first series of treatments.
I'm getting the IPL treatment in order to have a great outcome with LASIK. Having the treatment, having as much moisture in my eyes as possible before the treatment will result in hopefully the best outcome possible. The laser treatment is quick, and also once you get the extraction going, that goes pretty quickly too.
We wondered if there were other causes and treatments for dry eyes.
Sometimes these meibomian glands that produce the oils to prevent the tears from evaporating, sometimes they get actually covered and completely plugged up with a tissue that closes them up. And so we use a very thin probe that opens that duct, and that way the gland can start producing the oils again. The other thing that we are doing for people that don't produce enough tears is we're closing the drains for the tears. We call them the puncta. And there's one in the lower lid, one in the upper lid. So we're using cautery or heat to close that duct that drains the tears, so what little tears people make stay in the eye longer. Dry eyes can, especially moderate to severe dry eyes, can absolutely affect every aspect of your life. And so there are patients who can't work well because they can't see very well, they can't drive well, they're constantly in pain and discomfort, and it just completely makes them irritable and changes your whole life. In addition to not enabling you to see well. So these treatments have made a huge improvement in patients who are basically at the end of their road, where there's nowhere to go because they've tried every drop on the market, every pill on the market, everything, and nothing has worked.
It's much better. I can't wait till I get all 4 treatments and I can get my LASIK.
It is really exciting to take care of some of the patients that we take care of who are at the end of the road, so to speak, because it changes their life, it changes their outlook. It's just like a new lease on life. They're just suddenly able to see well, go back to work, are able to go out and socialize and enjoy life again. It is life-changing. It definitely can be.
The first reference to treating cataracts was found as early as the 5th century BC, the 1600s, the 1700s, or the 1900s. Your answer when we return. Now you can take the American Health Journal with you. The doctors you depend on for instant information are as close as your mobile phone. So go to ahjmobile.com and get the latest medical information you need. So when was the first reference to treating cataracts? The answer is A. Early references to treating cataracts are found as early as the 5th century BC. Now, with a report on the advancements in the LASIK procedure, here's our reporter, Laura Windsor.
According to the American Academy of Ophthalmology, more than 700,000 LASIK procedures are performed each year in the United States. Yet even with the tremendous results and millions of people with permanent improvements in their vision, there are still millions of good candidates for LASIK who still wear glasses or contacts because they question the safety and efficacy of LASIK surgery. Dr. Gary Lovchick of NVision Eye Centers talks with us about the advancements in LASIK surgery that are bringing hope to patients who were previously told they were not good candidates for the procedure.
Lots of patients are interested in not wearing glasses or contact lenses, and so LASIK is another means of helping these patients to rid themselves of glasses or contact lenses and make life a bit easier for themselves. We as optometrists are involved in the preoperative care of the patient because we know the patients very well. Many times these patients are long-term for us, and so we understand their needs and their makeup for their vision.
I have been performing LASIK since 1994 as part of the FDA clinical trials to get the lasers approved in the United States. The lasers officially got approved in the United States in '95. So with advances in technology, the procedure has become extremely safe. Obviously, nothing is 100% safe, but I have chosen to operate on my brother, who's an orthopedic surgeon, getting ready to operate on my wife and my son this year as well. And I've operated on more than 250 eye doctors, and when the eye doctors move forward and have the surgery, you know it's arrived.
Well, I had my anniversary actually was 10 years ago yesterday, and so I still call it anniversary because it's still very, very exciting to not to have to wear glasses, contact lenses, and to be free from all these types of things to hinder your vision. But what I was looking for is somebody who's done many cases and that it practices at a very high level of technology and that is very credible amongst the eye care community.
The advancement of the laser making the flap has made the procedure much, much safer, much more precise. It has substantially reduced the chances of dryness in the eye and substantially increased the statistical chance of getting 20/20 vision. The other advancement is this wavefront or custom technology that has improved the quality of vision, especially at night, making the symptoms of halos and glare that were common with the old lasers that were used become extremely uncommon, to where there are less than 1% of the patients having these symptoms. It also improves the statistical chance of getting 20/20 vision. Basically, once we do the procedure, the goal is to get someone to perfect 20/20 vision, and that way they never have to be dependent on their glasses and contact lenses. So if we can use software to take our experience of operating on thousands and thousands of patients before, and I've operated on 100,000 eyes or more with LASIK surgery, but if we can take that experience and input all that data in the software that we have, it basically makes the chances of needing an enhancement minuscule. So our statistical chances are close to 1% of needing an enhancement. While if you look kind of nationally, the statistical chance is somewhere between 5 and 15%. People who have been told that they're not candidates for laser vision correction should seek another consultation now with someone who has a lot of experience, because technology has changed and we're able to offer surgery to people who are not candidates in the past.
LASIK improved my lifestyle by helping me to be able to not have to use glasses and contact lenses, and made my life more convenient. To be able to get up and not have to wear contact lenses, glasses, and I'm avidly involved in sports, and so basketball, racquetball, all these things became so much easier when I was able to not have to wear glasses or contact lenses.
We asked Dr. Lovchik to tell us about Revital Vision.
The idea behind Revital Vision is that if you think about the old adage from sports, you give 110%. Well, LASIK gives 100%, but there's still 10% there that we can train the brain to do. So Revital Vision will actually improve your results beyond the physiological values of LASIK, and so to give patients even more of a visual edge in their lifestyles, for sports, and whatever they do.
If you've been told in the past that you are not a good candidate for LASIK, constant advancements in the procedure offer new hope. For the American Health Journal, I'm Laura Windsor.
A cataract is the clouding of the normally transparent crystalline lens within the eye, and it's usually the result of aging, metabolic changes, injury, or drugs. Great strides were made in the 1940s in cataract surgery with the invention of the intraocular lens, a permanent plastic lens implanted in the eye to replace the clouded crystalline lens. In recent years, there's been a rapid evolution in the designs, materials, and implantation techniques for IOLs, making them a safe and practical way to restore normal vision at the time of surgery. We spoke with IOL implant expert Dr. Dan Tran of NVision Eye Centers in Newport Beach. He told us about the advancements in IOL technology.
Once a patient considered to have cataract surgery, they have multiple choices with different type of lenses that's going to be implanted in the eyes. The newer versions of the lenses designed where they call multifocal lenses or accommodating lenses allow patients to see with a larger range of focus. So they will see at distant, they will see at intermediate, which is computer, and they can also see close-up for reading, thereby reducing their dependency on glasses down significantly.
Standard monofocal lenses provide great distance vision, but they do not give you all the other needs that most people have. Cooking needs, computer needs, anything up close, the monofocus lenses are not able to provide good vision there.
My close-up vision was deteriorating. My distance was really, really bad. I was dependent on glasses, tried contact lens, weren't working. Just figured I was going to have to wear glasses the rest of my life, and the prescription kept getting stronger and stronger and stronger.
Premium IOLs simulate natural vision. This is your vision prior to age 40, when presbyopia sets in.
The crystal lens is the what we call an accommodative IOL, accommodative intraocular lenses. It's pretty much unique. It's the only FDA approval accommodative lenses in the U.S. right now, and it's allowed the patient to be able to see at distant and to see at close-up and intermediate without the use of or reduce their dependencies on reading glasses.
And once they realize the benefits of the premium lenses and the vision that follows, the freedom from having to wear glasses, they opt to go to those premium lenses.
The uniqueness of it is with the multifocal lens, sometimes you could have some what we call visual aberrations such as halos and so on at night. With the crystal lens, because of the accommodative effect rather than multifocal effect, you kind of maintain the quality, the distant vision at close-up or at intermediate level. So it doesn't have some of the halos that people might see with the multifocal lens.
Because I hadn't realized that things had been changing a little bit, because it's gradual. And yeah, all of a sudden I was reading signs at a distance and things like that were great.
The femtosecond laser is basically a technology that's being used for laser vision correction or LASIK for about 10 years plus now in the U.S. and also in the world. And with the technology, the femtosecond is a very short pulse laser. And the reason that we need a short pulse laser so that it does not have any time to cause collateral tissues damage with heat generation. Now they apply in that technology to use it rather than the cornea. They will do that on the lens. So the laser will precisely fragment the lenses. So now the laser can come out and do the precise configuration of those cuts. The more precise we do, the more consistent the result would be and the better the outcome.
Most often cataract surgery is covered to a great extent through their insurance.
My distant is great, my intermediate is fine. The distant, great, intermediate, and nighttime when I drive, it's just great, no problem.
When you get up in the morning, the first thing, I have got crystal clear vision. It's great.
Orange intraoperative aberrometry is basically a technology that's being used to measure the refractive outcomes, which is basically the prescription of your eyes at the end of the surgery, and help us to choose the proper lens to put into the eye, and just an additional step to make it more precise. And the more precise we can get, the less likely the patient have to wear glasses afterward.
There are so many different options for the new premium IOLs that if a patient is not looking or consulting with the right person, they may not be able to take advantage of the latest in science and technology right now.
Those patients that are looking for cataract surgery want to find a doctor that they can talk to, feel comfortable with, explain their visual demands, so that their post-operative outcomes are exactly what they want.
Science and technology has been so wonderful the past decade. It's a shame that patients do not take advantage of this new technology.
So the key thing is we need to pick the right technology that will match with the shape of the eyes, with the condition of the eyes, and with any other pathology that you might have in the eye. There's no such thing as one size fits all.
computer work totally without glasses, which is great.
Patients who have received the premium IOLs, the first reaction afterwards is, wow, this I've never expected to see so clear before.
Like a new day in the world, you know, like real bright.
I would recommend it to anyone. I think it was great.
So, where are we headed for the future of lens implant technology?
The idea is to maximize the range of focus for patient, to be able to see clear everywhere. Just like your vision when you're 20, you don't think about it. You see distant, you see close up, you see near, you don't think about it. And you don't have to compromise your vision to get that.
We'd like to hear from you and what you think about the American Health Journal. Any topic suggestions or comments about our doctors, email us from our website, thedoctorshow.com, or call 1-800-303-3200.
With such a wide range of technology available, we asked Dr. Tooma to give us some insight from his experience about the role technology plays in surgical eye and vision care.
You know, one of the things that drew me to ophthalmology was that it is so high tech, and so we're always dependent on this technology that is constantly evolving. You know, software getting better, and you know, the technology getting more intricate and better. And this has the nice thing about it is that it translates into better quality of vision, better safety, quicker surgery. So technology is awesome, and I love working with it because it is always changing, so it keeps life exciting for me. And when you combine the best technology and the experience, you end up with good quality outcomes safely. So it's the experience plus the outcome of the procedure, and they both have to be good to end up with a very happy patient.
Join us next time when the American Health Journal brings you more in our ongoing series for your better health. If you have questions about topics or doctors you've seen on this show, you can contact us at 800-303-3200. And now you can get AHJ on your mobile phone. Download our app from ahjmobile.com. Until next time, I'm Roger Cooper for the American Health Journal.